The CDC now says the coronavirus does not easily spread by touching surfaces. The new information has people confused since other studies found it can live on surfaces for days. Stephanie Whitfield explains why the CDC has changed its guidance.
How does COVID-19 spread? In March, the CDC, NIH, UCLA, and Princeton released a study that said the virus can live for hours on copper and cardboard and up to 2 to 3 days on plastic and stainless steel. It's no wonder cleaning products flew off the shelves. Some people even sanitize their groceries. But now, the CDC says the virus does not easily spread from touching surfaces or objects. What changed?
That original guidance was based on kind of experimental data. And the authors themselves said, we don't know what it means in real life. And then so now we've had several weeks of real life information that suggests that that type of transmission from surfaces is less likely.
Dr. Michael Chang with UT Health says that real life data comes from health departments and international reports. For example, studies of outbreaks at a call center in South Korea and a restaurant in China found the virus spread through close person-to-person contact.
You should still do your hand hygiene, and you should still focus on those high-touch surfaces, but you probably don't need to worry as much about packaging your groceries, your takeout containers, things like that.
What hasn't changed is the fact that the coronavirus is highly contagious, especially when an infected person talks, coughs, or sneezes. So doctors say social distancing, wearing masks, and washing your hands often continues to be the key to staying healthy. Stephanie Whitfield, KHOU 11 News.